Hello, good morning or afternoon, everyone. Thank you for joining us today. My name is Hunter Hurst, and I am a Senior Research Associate at the National Council of Juvenile and Family Court Judges, and I will be helping to facilitate today's webinar and working in the chat box and helping to keep things moving. Before we begin, I want to remind everyone that you will be muted, but at the end, similar to previous linking systems of care webinars recently, you can use the raise your hand icon up at the top menu bar to raise your hand, and Alicia will kindly help us unmute you to interact verbally with a presenter. In the meantime, let's warm up the chat box by everyone chatting in who they are and where they're joining us from. Okay. Thanks for joining us, Laurie from Virginia, our two presenters, some of their colleagues. Thanks for joining us, Shelley from Columbus, Ohio, Nancy also from Columbus, the great state of Ohio. Okay. I'm going to now introduce our presenters, which we're thrilled to have. We're thrilled that they could put this together with us as soon as we saw the announcement for the center. Remember, we'll be recording today's webinar, and I'm going to introduce now Marina Duane. Marina Duane is a research associate in the Urban Institute's Justice Policy Center, and she has substantial experience in policy research and analysis. She researches multidisciplinary justice policies and provides technical assistance to local jurisdictions on implementing evidence-based practices and improving policies. She's joined by Laura Poles, and Laura is a research librarian at the National Center for Victims of Crime, working on the Center for Victim Research. She has 9 years of library research and instruction experience, and at CVR, she maintains the online library collection and provides search assistance to library users. And with no further ado, I'll turn it over to Marina and Laura.
Thank you so much, Hunter. Hi, everyone. Thank you for joining us. It seems like we are pretty heavy on the East Coast today, so probably good afternoon. And just to give you an idea of how this webinar came about, Hunter and a couple of colleagues and I from Center for Victim Research got on the phone, talked, and exchanged notes about what each of our projects is doing, and then we quickly realized, wouldn't it be great for us to connect with you directly, talk about what we offer, and today really the purpose is for us to also hear from you what you guys are doing. We started getting an understanding of all the great work you're doing for the youth and children who are exposed to victimization, all kinds of victimization experiences, but we know there are nuances, so we would love to see how we can be of help and really learn also from you. So it's been like 6 months since we talked about this, so it's great to now connect with you directly. And I wanted to start by telling you what the Center for Victim Research is. We are pretty newly established one-stop resource center, and we are a community of service providers and researchers who routinely collaborate to improve practice through effective use of research and data. So we are trying to make sure that research becomes accessible and relevant to the practitioners. But as many of you who are probably working with folks on the ground know that often research lags behind on what is happening in practice or on the ground, what's happening in real life. I know that I've done evaluations, multi-site evaluations, and then the practice has changed. People have moved on, and then you're sitting and reading your own report, and you're like, that's not what we do anymore. So basically, we are trying to bridge that gap, make research more relevant, and then also help practitioners use the evidence to improve their practices. So a really broad mission, but today Laura and I will walk you through all kinds of resources that we have that I think will translate it, I hope it will translate into something very practical. And just so you know, we are the partnership of 3 agencies, bringing researchers and practitioners together from the Justice Research and Statistics Association, the National Center for Victims of Crime, and Urban Institute. I do want to say, probably the slide is not news to you, we are funded by the Office of Victims of Crime. Today, the content of this webinar, as well as everything we produce on the website, are our own opinions, findings, conclusions of the contributors, and they should not be attributed to the official position or policies of the United States Department of Justice. Hunter already did a lovely presentation, so you will be hearing from me and Laura today. But I do want to say that there are quite a few colleagues who work with us on this project, and we will be telling you about resources that they have to offer. And to give you an idea of what we will, how we will orient our conversation, sort of an agenda, I will walk through technical assistance support that we have that I think will be relevant to some of your work. We will also talk about how to get connected with us and the resources that are available on our website. My personal goal is for you to start getting really familiar with our website and feeling it out if you haven't done so. I know that a lot of people already start testing it, but we will show you a couple of interesting ideas how we produce documents on our website. We will also talk about featured research. I will briefly start, and then Laura will take over and walk you through some featured research that we post. And then Laura, who is my wonderful colleague, and I should say shout out, she works with people individually, she handles our library, and helps a lot of practitioners who do not have access to research really find it. So shout out to Laura. And kind of like I said, we have about an hour for the webinar content where you will be hearing from us, but do please stay tuned because we will be doing audience polls, so we want to hear from you, and we want to make it will be a real test who is multitasking. But in the end, we have about 30 minutes where we want you to ask questions and also hear more nuances and questions you have maybe on research, bridging the gap between research and practice on your own projects in the demonstration sites. So about 30 minutes for that. And with this, I'm going to turn it over to Laura, who is going to start us with a small activity. Laura?
Great. Thank you, Marina. Is this level of sound okay?
Yes, it
good.
is.
Can you hear? Okay, great. I'll get started. So thank you, everybody, for attending. Marina had a really good intro, and this slide is really just some questions for you to consider. They may be some things that you would want to share in those last 30 minutes when we're talking with people, or if you feel compelled, you can share in the chat box right now. But just some kind of framing questions about how the Center for Victim Research came about and what we're trying to accomplish. So you can use the chat to respond, or we can just talk about it later, but just, some things to think about. We've heard some answers from the field related to service providers' reactions to research and evaluation. Sometimes people are really cautious and wary about it. They can feel sometimes as though researchers aren't asking the right questions, that they might just be grabbing some data and not sharing any results with practitioners later, or sometimes their interpretations, the researchers' interpretations of data might feel way off from practitioners' experience. On the other hand, some practitioners and service providers have had great experience with research, or they're really excited about it. They want to move from anecdote to evidence, things that they have experienced. They also want to have this broader view of how other programs have worked, or have a really systematic way of studying and understanding things that are happening in their programs and their communities. But that is also something that we've heard from people. So I don't know if other people who are attending have had similar experiences or cautions or excitement too, or things that they wish were happening. but we'd love to, okay, great, we do see that we have a chat there from Lori. We are challenged in evaluating and especially validating our screening tool. That is definitely difficult. And I think that connection, too, with other states can be really valuable, even when you know that not all elements will work in your state for various reasons, but just getting to learn from each other. Thank you for sharing that, Lori. And I think with that, I'll probably just turn it back over to Marina, and we can talk a little bit more about what people are experiencing and how the Center for Victim Research is trying to fill some of those gaps and help meet those needs.
Thanks, Laura. And I wanted to add to Lori's question. Lori, validating the screening tool is a huge task. I hear you. We are still working, just so you know, on a section on our website about the screening tools that are specific to different types of victimization, so please stay tuned. I will tell you that I also work at Urban, and I know that Urban has another project on public safety risk assessment tools. Those are more general, and I don't want you to be under the impression that it might be specific to younger people. But I will say that on that website, there are some really interesting questions to consider on implementation. So you can definitely, if you haven't seen that, that's a very valuable tool, I would say. But we can also work with you, and I'm going to talk to you in a couple of seconds how we can work specifically on some challenges that might a specific jurisdiction might be experiencing. So like I told all of you, I'm turning back to the slide. We do have the website that went live actually this summer. So if you haven't seen it, that's okay. But our intention right now with doing a lot of these webinars and conferences is to letting people know what's available, and also to get ideas, or if you have some research or a partnership between research and practitioner that you want to make available at the national level, we are also here to help with that. So I'm going to start with technical assistance support, and I will say that I actually tend to coordinate our technical assistance at the Center for Victim Research, and we have two types of technical assistance. One is broad, where we are trying to reach the field with more general questions. Kind of like Laura was saying, we have heard from a lot of researchers and practitioners already, and we developed some resources that I think would be useful. But before I really dive in, I want to hear from you, and this is going to be a test who is still keeping, who is not multitasking, although I do see that people are using the chat function, so hopefully you can answer. So you have a polling question in front of you, and if we can take a moment, and if you could answer this question: what tools or support would be most helpful to you if you were to start on a research or evaluation project, or I should say to you, you are in the midst of your project already. If it's already going on, you can just take that as a hypothetical scenario and just answer questions. What would be most helpful? The answers are defining measurable benchmarks, understanding program evaluation basics, exploring how to conduct needs assessment, explaining victims' protection and ethical concerns, analyzing qualitative or quantitative data, or individual support. If you have something else, please use the chat function. I'm not sure we'll have the time to go over all of them, but we will have the recording. We do review those, and then we make sure that we address most prominent needs through our Center for Victim Research website. So I'm going to give it one more second if folks haven't yet answered. I do see that quite a few of you have. What tools would be most helpful? Okay, so if folks still want to answer, they can, but it looks like we are split. 50% of people do need help with defining, really creating at an operational level what it means to have measurable benchmarks and to say, to be able to say whether what you're doing makes an impact. Also explaining victim protections and ethical concerns, not surprising. And again, for me, at least not surprising that 42% of folks are saying individual support too specific. So we are done with the poll. If we can get rid of the poll, I really appreciate hearing from you. In a way, this was a trick question because some of the answers or some of the questions that you raised is something we already tried to answer. So on our website, we have tools that should be helpful to you, for example, to figure out how to think through ethical concerns and victim protections. And right now, if I can share my screen so that I can demonstrate the site, I would greatly appreciate it, Alicia. So bear with me, folks. I'm going to share my screen with you. Okay, so here's our website. Ta-da! There are a lot of resources. Laura and I will not have the time to go over them, but like I mentioned, if you go to tools, you will see that we have some resources available on questions that you already raised. Because a few of you talked about victims protection, I will show you that if you click on victims protection, what we have done here is a compilation of our own resources. So for example, we produced a brief fact sheet where we describe all kinds of considerations you should have from reputable organizations, from our own research. So as you can see, it's very brief. Also, we have included, we don't want to reinvent the wheel. We are a hub, and we know that there are a lot of already resources available. So we included resources as well as some trainings from National Institute of Health on protecting human research participants. So you can consult our website for those kind of questions. One more type of product that I wanted to draw your attention to, we often work with a lot of victimization researchers who want to figure out how to do needs assessment, especially if it's at state level, like you guys have partnership. We have produced a very short video, if you click here on community needs assessment, that talks about really the basics of what you need to consider. And I just wanted to demonstrate to you that we recognize that not everybody has the time to read through lengthy reports. So what we try to do with our website and our just intention is to create multiple products that are accessible and ready to be used for you. And if you have questions, we're here to answer more of them. So I'm going to stop sharing now the screen and go back to the presentation. So please do take the time to check out other resources. But again, 40% of you said that, hey, your project, my project is too specific. I'm sorry, I just heard that somebody talked, so if everybody could make sure that they are muted, that would be very helpful. If we have folks who are talking and not muted, could you please mute yourself? Thank you. So, again, I know that your projects are complex and you have all kinds of questions. So we also have individual support, and that's where we would work with you on providing light touch TA about any question you have on research or evaluation. I do want to tell you that I don't want folks to be under the impression that you are going to hire a researcher who will go out in the field and do all the primary data collection and focus groups and interviews. However, if, for example, if you're just wondering about measurable outcomes, or Lori, like you were saying earlier on, you have challenges with the screening tool validation, we can work with you. And I should say, I coordinate our efforts from Center for Victim Research, but we have a lot of researchers who specialize on a variety of victimization topics, such as co-victims of homicide, domestic violence, of course, or intimate partner violence, younger folks who are experiencing different types of victimization. Importantly, we also have folks who specialize in different methodologies, basic research, those who know qualitative methods, those who really worked on applied research and evaluation. So again, we do have a number of researchers. If you are in doubt, please just reach out to us, connect to us, and we will make sure that we are as responsive to you as possible and work with you with the time constraints that you have. It's very easy for us to get connected with you. You can email us at technical assistance, so ta@victimresearch.org, or on our website, there is a contact link, and you can just say contact, and then you will choose need help with research, and we will be able to assist you. I also wanted to give you a couple of examples of what type of technical assistance we've already provided. Please know that this is definitely not an exhaustive list, but I just wanted you to see what we worked with that might be applicable. So, for example, here on the left in the state of Washington, we worked with a member-based organization that was working on a survey. It was a national survey that went out to all of their members. And this one was pretty defined and pretty quick. We had a researcher who walked through the questions and best ways to ask the questions and follow the best practices. And then we walked through how to ensure a good level of completion rate. So that was one request. Another one here on the East Coast to the right of your slide. I know it's very hard to see. I apologize. But we worked on evidence-based practices for victims who suffered sexual assault while they were on duty in military. Very interesting topic again, and we had researchers who compiled evidence-based practices for folks so that, and that one was very applicable because they were changing their internal policy and reporting to the Congress. And then the last, but definitely not least, which I think hopefully will demonstrate that we work on something that might be relevant to Lincoln Systems of Care, to your guys' project. So we had a request come in from the International Association from Chiefs of Police, very similarly 3 demonstration sites that were funded to enhance their victim services among the law enforcement agencies. ELERV is the project. And each site, like you, had a researcher. What we have helped that project with was making sure that all the efforts across the sites were actually in uniform and that apples to apples were being compared. So a lot of guidance was provided on process evaluation. So those are the types of examples of technical assistance we provide. Again, if in doubt, just reach out to us. We will let you know if it's in scope or not in scope, and we will be here to help you. Okay. Another aspect of our work that I wanted to highlight is the page on our website that says Get Connected. And in here, we know that there are all kinds of databases that already exist of service providers in victimization fields. For those of us who work in this field, we know that OVC and the National Center for Victims of Crime have their own databases that are useful. It's not that difficult to find service providers. But at least according to our knowledge, the researcher directory did not exist for folks who actually specialize in victimization and different types. So that's the gap that we try to address. And the way we did it is, again, on our website, if you are a researcher, and I know that some of you are, and you want to be registered and you're not registered yet, if we can achieve anything out of today's webinar, if more folks can join and get registered, we would definitely welcome it. We have a pretty robust database nationally, but we are definitely trying to grow it. And the way to do it is by going to sign in on our website and choosing a researcher. And then you will be prompted to ask questions on whether you want to be registered as a researcher. And we usually ask you to provide a picture so that people have a familiar, friendly face. If you are the practitioner and either you're working on your project for Lincoln Systems of Care or any other project, and you want to connect it with either a local researcher or someone who specializes in a topic, and it doesn't matter to you at all whether someone lives in Washington, D.C., or in California, or in Portland, Oregon, you can search by states on our website, and you can also certainly search by types of victimology. And last but not least, on Get Connected, as I mentioned already earlier, we are trying to disseminate knowledge that already exists, a lot of work that has been done. So we have webinars that are held monthly, just kind of like we are talking to you today. We hold them on a variety of victimization topics, such as co-victims of homicide, using VOCA funds to help domestic violence survivors, or tips on national crime victimization survey and interpretation of that. We have a variety of webinars. Please tune in, and we usually have a lot of folks attending those webinars as well, and recordings are available on our YouTube channel. And we are super excited to let you know that we finally launched our podcast series where we are really trying to stay true to the mission, and we are trying to bring the voices of practitioners and researchers. We already have a first episode available. The podcasts are called Tell Us About It. And the first one is on Rocky Mountain Victim Law Center, and both the angles of the researcher who worked on the needs assessment and the practitioner. So we hope you tune in for that as well. Okay, so now we are going to walk into, I'd like to talk through featured research. I will get us started, and then Laura will take over and talk about multiple ways we are featuring research that is already available. So, at Center for Victim Research, we recognize that it's very important for us to synthesize the available knowledge, but we also recognize that in many ways, researchers have done that through meta-analysis or literature reviews. It was important for us to create research syntheses that stay true to our mission, that synthesize knowledge that happens in practice and best available research that is rigorous. So what we have done is we developed what we call research syntheses. We started prioritizing them by populations that are either underserved or least researched. So the first product that I will talk to you about, and I was part of that with some of my colleagues at the Urban Institute, and that is co-victimization, homicide co-victimization, very difficult topic. But we have other topics such as mass violence and terrorism, elder abuse, theft and identity fraud, and many others. And what we have done with research synthesis is we adopted the Center for Disease and Control model that really expands our understanding on how we should understand evidence. A lot of people, if you hear evidence, a lot of people jump into this blue circle that you see in front of you on the screen, right? It's rigorous analysis, experiential evidence. But what the model tells us is that how something is implemented matters. The environment, the legislation at the state level, how practitioners implement it also matters. And also there is, what CDC model tells us is that the way victims experience something is also very important. So the best available research is something that really lives in the center of this Venn diagram, right? And so what we have done with our syntheses is that we developed a standardized method to collect best available research and also what we call practice evidence. We have come up with a standard way to ask a series of questions to say, okay, are there any limitations to this source? How do we go about finding those? And I am happy to elaborate on that if folks have questions on our method. But the way we ensure quality is by having multiple ways to do internal checks by senior researchers who review our products. But importantly, we engage with practitioners and researchers known at the national level in these victimization topics to review both our outlines to tell us, hey, this is what you missed, or maybe you should consider this or not concentrate as much on this. Then we take that, we develop a number of different products to disseminate that knowledge. And that's what I wanted to walk you through, what we have available. So let's take a look again. I'm going to share the screen. So Alicia, if you can let me share the screen again. Thank you. Okay. So if you go on our website, if you click on the research tab, hopefully the website is becoming familiar now, and you go to research syntheses, what you will find here is a little bit more information what I just shared with you about the model. But as I said, we already have some products on homicide co-victimization. We published a very quick research brief. That type of product is oriented towards practitioners or researchers who want to see at a glance what we found. We also have a longer product that will be available very soon. I promise we are in the final stages of production for that. And as I said, we do have a webinar where we brought in practitioners and people with lived experience to really discuss the topic. And as I told you, we have a number of topics also forthcoming, so please stay tuned and go back. If you have ideas or if you have any questions about these, please also contact us through this link. Okay, I am going to go back to the slides now. I'm not reading the chat function, but I will after I'm done. So this is just an example of how we synthesize knowledge and do our own research on what is available out there. We would love to hear from you, but right now I also want to turn it over to Laura, who will talk to us about other ways we are highlighting research by a lot of other notable experts in the field. Laura?
Thank you, Marina. Great overview. So the part of the website I want to talk to you now is also part of the featured research area. This is a spotlight page. And what we do on this page is we try and amplify what already exists out there. So these are updated quarterly, and usually we try and have them organized around certain themes, such as the commemorative and awareness days or weeks or months. So you'll see here some from the summer and the fall. And winter is coming. We will have our winter spotlight available soon, and you can always go back to see previous quarterly spotlights. We have an archive there. So these can be really useful if you're planning any kind of outreach or fact sheets, trainings that relate to some of these awareness months or awareness days. We try and find some of those research-based reports for you. Another type of research that we're trying to foster and support we have two types of funded projects. So the first type is a collaboration between the Victims of Crime Act administrator or compensation person and the Statistical Analysis Center. So these organizations can really help inform each other's work. One of the reasons that we have these partnerships was to create some long-lasting relationships. What we found in some of the applications that we had, some people said that they work in the same building, but they've never even met each other. So it was really exciting to see them come together, and we had with just a short amount of time, small amount of money to focus on a very specific question that they had. And one other part that I have really enjoyed from this project a little bit that I've gotten to listen to it were not only the relationships between the state agencies, but also between states. I mentioned this earlier as kind of one of the exciting things about this project is getting to learn what other programs are doing. And so just knowing what other states are up to for these agencies has been really neat. And they had an in-person meeting a couple months ago where they got to share some of their latest findings from this project and then really interact with each other about where they want to go next. And for some people, they also realized that before they could even accomplish what they wanted to understand, they had to do a lot of the infrastructure work. So they used that time, this small grant, to really update their data collection methods, just try and standardize things so they could make sure for the future to have more quality information. That also was an important outcome for us. And I wanted to bring this map up just so you could see a little bit about some of the projects. We have all the states highlighted, but we only included a couple summaries of what people were trying to understand in that year-long period. So for example, Minnesota conducted a survey of the juvenile correction facilities so they could better understand the prevalence of victimization among that population and their needs, and then any services that were available. In Wisconsin, they had this really neat project, part of again, that need to build the infrastructure or improve the data collection before you could even take action on the data. They used some text mining software that they applied to their performance measurement. I always forget what PMT stands for, but the PMT data that they were receiving and the narratives they were receiving to really understand what was already being collected, what kind of information was resubmitted every year, and from that, trying to understand and improve what they required their subgrantees to receive. Another interesting project that I got to hear about was from Arizona, where they were mapping crime data and service data over each other so they could see where the gaps were and where people's needs were being met and where they might try and introduce services to underserved areas. So that's just our first cohort of the VOCA-SAC partnerships. We recently have been approved from the Office for Victims of Crime to fund 4 more of these partnerships for a 9-month period. So we'll be announcing those soon. And the final reports from this current cohort will go out, I think, towards the end of December. I mentioned we had 2 kinds of partnerships. So the other type of partnership, the first one was state level, and then these research practice partnership mini grants are very local. They included a researcher and a victim service provider. So like the VOCA-SAC fellowships, these partnerships were at various stages. Some people had already been working together for a couple of years. They just applied to the grants to have, again, a very specific little part of the data they may have already collected that they wanted to understand something new from, or they may have been a newly established partnership and they wanted to use this money to really build their relationships and start understanding what they wanted to study and how they could work together. So a big part of these funded projects were to promote that type of cross-learning that is a huge part of the Center for Victim Research's methods and goals. And again, another map of where these local fellowships were funded. So again, these were not statewide. These were very specific and local, but just states are shown, so it's a little easier to see on the map. So some examples are listed there, and we'll be sharing their reports soon as well. And we've also received approval for funding another 6 of these types of fellowships. So we're really excited to share those findings with you all as well. And you may find some similar things from your own projects that you're studying. And with that, I am going to start talking about the part that I know the most about, the Center for Victim Research Library. And one thing I'm especially excited about is that the projects here are all Victims of Crime Act funded, and so you will have access to the whole range of things that our library offers. So this is from the home page. You'll see the search box there at the top. We also have some search tip sheets. I'll be adding more of those so you can really get the most out of your search. And on the far right, we also provide tailored library assistance. So the Marita provides technical assistance, and then I can help you find things in our library if you're looking for a particular article, or if you're curious about what articles or research already exists. I can look in our collection and send you some things that we have. So whoops, a little too fast. What I'm hoping this talk can help you do is that it can be a single entry point to the existing evidence. You can search in your own words. It doesn't cost anything, and like I said, I can provide some tailored search help if you describe a little bit about what you're looking for and what you're interested in. We just want to make all that existing research easier to find. You'll see that we have partner libraries, and I'll talk a little bit more about them in a second. And we recognize that other people have already been trying to collect evidence and research on different projects. We just want to make sure that you find it and that it's all accessible in one place. And to that end, we've also partnered with some similar projects. A lot of these projects have very specific populations that they include research about, such as child victims or elder abuse victims, or they have a specific type of victimization that they're studying. So we partner with these organizations to make sure we're not duplicating any work. We just want to point to the people who are likely to have it. So if you haven't already looked at the Child Abuse Library online, that one in particular might be of interest. There's less on victim offender overlap or justice involved youth, but there are some items. So I would recommend exploring these libraries as well. And if we receive any questions from people that we know these organizations have already provided technical assistance on, or maybe they've created an annotated bibliography, we would want to make sure to push people to those and use those first. So since I talked a little bit about other libraries, I also wanted to highlight what's unique about the Center for Victim Research So we cover all types of crime victims, every type of victimization, every type of service. We're trying to be that single hub to point to where everything exists. We also include a combination of easy-to-read formats, so those things that take just a couple minutes to read, something that you can grab and go. We know that people are really busy, and so when you just have a short amount of time, you're able to still learn a little bit about the evidence base. Another thing that's nice about these is a lot of the time, as Marina was saying earlier, in the academic publishing field, the research may have happened a couple of years ago, and then while going through the peer review process and becoming and having the article be fitted into a particular journal issue, it can be a really long time between when the research was conducted and then when the results actually are available. So having some of these other working papers and quick turnaround reports can be a really nice complement to the academic journals that are also available. And all of the content in the library is research-based. Some of our partners have, in addition to some research materials, they also have some practice manuals and best practices guides. So CVR library is focused on content that's research-based, and we have a whole number of things that do count as research, but just so you're aware what's available there. I also wanted to list some journals that we have that might be of particular interest for the attendees today. So if you see any there that interest you, shoot me an email and I can send you articles that you've heard about from these journals or help you set up a search that you can get results related to your topic and your organization. And the last part about what's in the CVR library, your reports. So once your projects have wrapped up, and if you have any kind of final reports or fact sheets, summaries, your gap analysis, all of these things, we would love to link to them from our library. So feel free to send me any materials you have, and I'd love to catalog them and make sure other people can find them as well. Similar to what Marina was talking about with the technical assistance, I wanted to quickly share just a few situations where people have reached out to the library and some ways that I've worked with people to find the information they're looking for. So, for example, one of the early questions that I got related to those times when you might be in a training or you're chatting with coworkers, or maybe you're hearing something that your legislature is talking about, and you hear the phrase, everybody knows, and there's some kind of statistic, or, I mean, to me, anytime I hear everybody knows, I have a little alert that goes off in my head, just like, oh really? How do we know that? Where does it come from? There's a lot of common knowledge, so it can be really important to realize the origins of it. And one of these kinds of questions related to, everybody knows that interventions that occur within 72 hours can greatly reduce the need for long-term services. So I helped search through the literature to try and pinpoint where those 72 hours comes from. Another question related to this I received, a person had heard 1 in 3 or 1 in 4 women experience intimate partner violence, and this requester wanted to know, why are there 2 different statistics? And so I looked through where those statistics came from and discussed why there might be 2 statistics like that. Another situation where you might reach out to the library, if you're regularly presenting to audiences who might not have a background on the topic, or they may not be as fluent in victim-centered practices. So it might be useful to use the library to find studies that can add to the understanding. Sometimes people find it easier to believe things if they feel there's, quotation marks, an objective finding that proves it to be true. So just having some research-based materials to complement what you already know in the field and that can give a broader view. So for example, I was working with somebody who was trying to work with their legislature about why they needed a longer funding period, why just a year-long funding wasn't sufficient for most people that they were serving to start recovering. And I put average in quotation marks as well because, of course, everybody has a unique circumstance, but just having some kind of data that they could work with and show the legislature why they needed a longer time. And finally, my final example relates to, I think, very similar things that the programs on this call are interested in. If you're just evaluating your own program and just wanting to know, has anybody else done a similar program, and what elements have they found that are most useful? So those are a couple samples that I've worked with people before. So having culturally responsive interventions for LGBTQ+ youth of Asian descent. So there's a lot of factors to keep in mind, the age, orientation, and gender identity, as well as ethnic and racial background. Also, just understanding what services are available for incarcerated individuals who may have experienced victimization as well. So those aren't comprehensive. There's a lot of situations you might want to get in touch. So please let me know, and we can work through your particular question that you have to find what already exists out there. So I'm going to also try and do a live search of our collections. You can see a little bit about what's available there and a couple of the filters. Thank you, Alicia. Okay. Okay, so looks like it should be sharing. This again is our library homepage. Right now I'm logged in, so we'll see the full collection, which includes subscription materials as well as the open access free materials that anybody can search without logging in. So I'm going to search very broadly to start and look for justice-involved youth. So once you're logged in, you'll see a list of the results that we have available. You might also sometimes see contact librarian for assistance. We include even materials that we don't directly subscribe to, just so that you can know that they exist. And we have a few different methods for getting a hold of articles or buying articles that are one-off. So if you see that, please let me know, and I'll go through and do what I can to find the full text or find an alternative that would be useful. So on the left-hand side, you can use a bunch of filters to really focus your results. For example, changing the publication date. You can also limit it by what we have in full text. So if you are in a hurry and you really need something that's available to you right now, you're able to filter it that way. And once you're in a record, we can actually open one up. If you click on the title, it'll pull up the record and tell you a little bit about who wrote the article, the abstract, and this one actually opened right to the full text. Sometimes they even surprise me when it's a live demonstration. So if you see any articles like this, you can send them to yourself or go back to your result list and keep looking for something else. You can also add a bunch of articles to your folder and then email a number of them at one time. Oh, that's what I was going to show you, just what a record looks like. Okay, thank you. I think I can stop sharing. Great. And I wanted to give a couple tips. So like I said, you can search in your own words. You don't have to try anything fancy. But if you do want to really focus your results, there's a couple quick things you can do to really boost them. The first one is to use and. So if you put and between the words that you're looking for, that tells our search engine that you only want results that include all of these terms. So all of those terms must be present in the results. So I have on the screen there an example of how that would look. So advocates and stress and resilience. So you are interested in research that relates to resilience in the workplace for victim advocates. Those will be a couple starting terms that will help you. You can also use or between terms, which tells our search engine that you want any of these terms. As long as one of these comes up in the report, that one works for me. So this can be really useful when you have a lot of synonyms or related terms that come up in the literature and you want to make sure that you get all of them. And finally, I also like to use quotation marks just to tell our search engine this is the exact phrase that I'm looking for. The settings that we have for our search will allow there to be a little gap between words. So if you want this exact phrase, similar to when you're searching in Google, you would put it in quotation marks. And I mentioned earlier that we have two parts to our collection. We have the full collection, which is what we just briefly looked at there, and then we also have our open access collection that has more than 900 open access reports. So those are the free reports anybody could find online, but that we've pulled all into one place and added our subject and tag terms so that you can search in your own language and still find results even if you don't add any synonyms. So to access that full collection that includes the subscription journals and articles, you can register on our website as a VOPA-funded agency user, and it'll ask you a couple of questions about your experience with research, just so that can help us just measure what you've been able to do since you've had access to our library when we check in again. So when you fill out this form, just make sure to have your Victims of Crime Act grant number ready, so you can enter that in there to confirm that you are somebody who can have access to the full collection. I want to emphasize again that we really are here to help you. I have the librarian one since that's what I'm talking about right now, but please also reach out to the TA inbox. We're really here to help you on any question that you might have, any point you might be in your process. Maybe you already have an article you're looking for, but you keep hitting a paywall. Please let me know and I'll do my best to get a hold of it. Well, thank you, Maria. And even if we can't get a hold of it for whatever reason, I'll do my best to identify similar articles or find the information in other ways. I'm also happy to help you craft your search. Sorry, I heard somebody chiming in there. Please go ahead.
Okay, that's the conclusion of our webinar content, and we have a good amount of time to ask any questions. You can do that verbally and get unmuted by raising your hand with the button at the top of the screen, or you can chat them.
Hunter, thank you. And this is Marina. While people are thinking about maybe their questions or thoughts, I just wanted to say, you probably now know the address for our website, but we are also available on Twitter. We have a YouTube channel, Facebook, LinkedIn. So please stay connected and do tell us if you have something that you would like to share. We will brainstorm together whether we should do this through the webinar or a podcast. People know about Lincoln Systems of Care work. We care about that work, so we are happy to disseminate or help you with some questions on research and evaluation that you might have, or library. So thank you, Joe, for the shout out about that this was useful, but I'd like to still give people time if they have questions or thoughts or want to share more about their project.
All of the projects are working closely with institutional review boards, and they're very heavy into those interactions and understanding that and the intricacies of it.
I hear you. So Hunter, as someone who has to live through the internal review boards, it can be painful, and especially if you work with vulnerable populations, or if you're trying to do any research activity with incarcerated victims or people who are just incarcerated. If folks have those kind of questions, We are here to help. I'm not alone. I coordinate our, for example, technical assistance, but I have a lot of seasoned researchers who have gone through the IRB and can help address some issues. So if folks have any questions, I'll be curious to hear, but we are also here to help through the technical assistance.
Thank you, Marina.
And Hunter, I'm curious whether folks have already, are all demonstration sites, are all projects, have they been approved by IRB? Are all the IRBs are in place?
They're on. We've got 2 sites that are in planning phase, and that's Ohio and Illinois, and then they've been planning for a little less than a year, and then we have 2 that are in implementation phases that have gone through a lot of IRB review and have to submit modifications on a routine basis to support things like listening sessions with youth victims.
Mm-hmm. Yeah,
so there's a lot of
something we have to work with. Yeah, and I suspect that there are some specific nuances, like, well, why are we doing this focus group versus not interviews? So it might be individuals. If folks have questions on that individual, we are here to help today or later. And I want to add that we hope that today is an introductory webinar. It's just a webinar, but maybe we can create partnerships and think about how to collaborate together in an ongoing basis.
Thank you. I think there's a lot of, just from what I've seen, I help with the Virginia site, and just things I've seen, well, once they are publicly available, will be useful for the library. And kind of this network has become expert in some of the intricacies of working with vulnerable populations and doing that in a legal and responsible manner, as we can see in the chat. One thing that I'd like to ask is there any research on the best way to stage projects that are demonstration projects, that are exploratory projects, that are blazing new trails in their sustainability phases? Because 2 of the states are starting to look toward when the OVC support concludes and sustaining their gains long term.
So this is always a challenging question, and sometimes sustainability comes to funding, right? And then also, have we gathered enough to demonstrate that it makes a dent while priorities shift? I would say that if folks are thinking about that and have questions, the first thing that comes to mind is that there is a whole area of research, and researchers here on the webinar will probably not be surprised, but I would start with evaluability assessment and seeing how those are done and what needs to be thought through and what can be documented, or if it already has been documented, how. But I think that has always been helpful to me. We have researchers on staff who have experience of doing evaluability assessments, so if folks have more concrete questions, we'll be happy to connect. But I guess, make a long answer short, yes, TA, go to TA. On our website, we do not have specifically evaluability assessment, but if folks are interested in that, we can do that kind of search through the library, or we can just assist you from our practical experience of doing those.
Thank you.
Yes, I'd love to dig in. That's my mind's racing already, trying to think of where to go.
And who
then
is that?
Was that Laura?
Who just,
That was me. That was Laura.
oh, Laura, sorry, I didn't recognize you. Thanks, Laura. Yeah.
If we unmute somebody, we'll announce. Well, I'd like to, while we're giving folks time to ask concrete questions, I'd like to go back to the one about screener validation, and any tips about how we would search well on trying to find guidance on how you manage a screener validation research project on a new screener, and it would include things like terminology translated and how to talk to the researchers about that terminology, things like internal validity of the screening tool and external validity.
Right. And so, Hunter, is your question about, when you are asking that, is there a tool that or a screener that is already in place and it's being deployed and someone is thinking through local validation, or is this a screener? There are a lot of off-the-shelf products that was already pulled, which probably means that it was validated, but there might be nuances because depending on how it was validated, it's not applicable. So if you could elaborate, or maybe the site can elaborate on what the questions are, it would help me think through a little bit more with you what can be helpful.
It would be the first scenario, local validation of a screener that is specific to linking systems of care, and tips that social workers and practitioners can use to manage the research validation, the local validation, what they gain from that process, what stands to be gained, and also just how to search for that online yourself. You know, what are the best ways to search? What are the best terms? Some of Laura's skills on that.
Sure. I can start, and Laura, feel free to chime in. So I think that the challenge with the screener, if there is a question on whether how is this useful or why is this useful, I think local validations, going through local validation allows you to really test whether the tool performs against the outcome you defined. The outcome is really challenging sometimes, right? So for example, I work on some evaluations, I'll tell you guys from the world I live in, and intimate partner violence, and specifically people who are charged with intimate partner violence offenses, so not so much on the victimization, but are we trying to reduce recidivism, or are we trying to track behavior change? And then when you're trying to use a tool, some places run into is that information is very difficult to collect. It's very difficult to answer certain questions, because if your tool relies on some administrative data and does not include the screener with the victim, you need to make sure that you have agreements in place for a person who fills out the tool to actually answer that question. Because for many of them, if you have a certain level of not available, you are either told this is not valid, or it's not eligible, or it doesn't inform anything. You don't know how to move forward. So I would say that data use agreements and figuring out how to get that information is important. If it's an interview with the person, and again, I'm not very familiar with the nuance of the screener, then there are all kinds of concerns and questions you need to think about: how your staff are asking these questions, whether they are trained, and whether there is a booster session, right? Because there is turnover, and if people do not know what they're asking and how they're interpreting that becomes challenging on the practice side, I would say. And then for the local validation, for somebody to come in, they do need to have access sometimes to data that is beyond just the screener. If you want, again, I will say about intimate partner violence, one way to see if the tool performs, you need to see at the recidivism level. You need to have access to either criminal justice data sets at the state level, better yet, jail bookings, and then it takes time to figure out whether this is a domestic violence charge. So as much as I always, my heart is with practitioners, but patience for researchers, I think, and help with getting access to the data just takes time. But local validations are time-consuming. They can be costly. And so what they do add is for you to know, okay, it actually performs against your population. It's not against some Canadian population that was predominantly, sorry if anyone is Canadian, but there were tools in like Odara or that where earlier validations existed, and they were done on just white people. And you work in the community where validation actually, where the composition of people is looks much different, right? So I think reading through validations is important, and if you need, again, help through that, we can help look at what is available and walk through that. So again, I'm sorry, I just took time to talk through some of my initial thoughts, but I suspect that there are more nuances to this, and again, I will be more than happy to connect online. And Laura, I don't know if you had any thoughts or tips on terms to search. Oh, and before I did share this in the chat function. There is a website on risk assessment. It's more general, and it's general recidivism, so it's not juvenile justice specific or youth or children exposed to multiple times of victimization. But some guidance and challenges on the implementation side I think are very helpful. So please check that one out. And we, as Center for Victim Research, are working on a compilation of the tools that will be available on our website that are specific to the victimization topics. So Laura, I don't know if you had any thoughts on that question as well.
No, I think you covered it very well. I guess search term wise, depending on where you're looking, if you're just trying to find other validations of the tool, we could talk through that too. But if you are trying to think of other search terms to describe populations, that might be another approach. So maybe there's not been a local validation in your region or your county, but maybe there's been similar populations. We can talk through that too.
Thank you so much, both of you. It's already been immediately helpful, and the takeaways. I'm eager to follow the link to the resource that you vetted on the risk assessment, and to know that it's beyond just not just juvenile offender risk of focused.
And Hunter, I just saw from Wendy a comment that the tool that is being discussed right now is newly created. So thank you, that's helpful. So I suspect that this is still being tested. I don't know when it was deployed, what went into it. If you are having questions about implementation, I know this is a very blanket response, but I've been with several communities, either evaluation or actually being on the side. I worked in the field in Pittsburgh, actually. I saw that someone was from Pittsburgh. Shout out to folks. It's my second home in America. But where I actually tried to introduce new tools, and like on the ground, we had no patience. But I would say that before going and figuring out, oh, the tool is giving me trouble, the information is not easy to gain, I would say every jurisdiction needs to take time to do homework and to figure out why. What are the questions? If you have analysis, you have great research on site, look at the questions that produce most trouble, that go unanswered. And then before you go to any other tool, the problem might not be with the tool. It's just that at the system level, there are no mechanisms for you to answer those questions, or there is no time or resources. So that's a different question than the tool performance, or there is some issue with it.
We look forward to connecting. Hopefully, I'll circle around with our teams, but I think you might be able to help us.
Yeah. We would love to continue talking, Hunter. Yes, with you and with the sites directly. Wonder if there are any other concluding questions or thoughts, or if we can be of any help.
Well, I mean, Nancy from Ohio has asked if there some of the examples of the SAC and VOCA partnership fellowships that were successful can be shared, and they're sharing them. So just to call that to everybody's attention, Laura's responding to that in the chat. Are there any other questions before we wrap up and let everyone go? Final call. Oh, my friend Laurie from Virginia is typing, so I definitely want to wait for that. Tension's killing me. Okay, let's see. So Laurie, who we collaborate with and who is in the midst and has been with implementing screeners and discussing their local validation. She says, I just wanted to mention that our team is having a lot of discussion about screening tool evaluation now, and then she'll follow up directly.
Yes,
okay.
More than happy to connect directly and see what you are up against and see if we can be of any help. Lori, thank you for also posing your question and mentioning that. And thanks, Lori. And Hunter, thank you so much for letting us take the time. And I also, from Laura, and from all of our colleagues at Center for Victim Research, just want to thank you all. We know that demonstration projects can be very, very challenging. They're so important, and if we can continue partnering, I would love to do that in multiple ways. So thank you all for joining us.
Thank you, Marina and Laura, and everyone that joined today. If you have any questions about the webinar, please contact me too as a resource, and remember to give us feedback at the end so we can keep improving. Thanks again, everyone, and have a great day.